Good morning, Dr. Daniels.
Good morning.
It is so good to see you and to be with you this morning. I'm excited to have this conversation with you and give us the opportunity to learn more about your wonderful organization, the Institute for Population Health, the work that you're doing in serving the community and the region, but also the work that you're doing as a part of our Regional Health Collaborative. The great work that we're also doing together in partnership. And so we SEMHA do a quarterly newsletter where we really like to dig into the power of partnership, especially given the broad nature of the Regional Health Collaborative partnership. You're one of the key stakeholders in that. Talk to us a little bit about, who you are, Dr. Daniels, and the work that you're doing at the Institute for Population Health, and also the work that we're doing together with the Regional Health Collaborative.
Thank you very much for this opportunity to talk about the Institute for Population Health. We are a nonprofit organization, and we started almost 13 years ago, providing services to the community. We became a federally qualified health center lookalike in 2017, and then we became a funded health center in 2019. And so that gave us an opportunity to continue our vision, which is to improve the health of populations and community in the city of Detroit. And I became interested in this project because we are a patient-centered organization. And we look for opportunities to partner with external partners that have a common vision, and whereby we could refer our clients for expanded services that we may not provide as a comprehensive primary care provider. We have expanded our services to include dental services. And with that being said, we partner with a dentist, Dr. Livingston, in Highland Park, and he provides that support for us. We also provide mental health services, and we are partnering with Team Wellness, and that's important for us. We partner with the Detroit Medical Center to provide specialty services for our clients as we identify health challenges that we don't have the capacity for. Partnerships are important because where your capacity as an agency ends, it can expand by working with others who could fill that gap for you. And it's important for this work with the Regional Health Collaborative that we begin to learn how to really identify the needs of the patients and begin to work among ourselves to see how we can help and bring the services to people that are pretty much barrier-free and where all people have access to services.
Wow, that's amazing, Dr. Daniels. Now, as the CEO, what's kind of a day in the life of your work? I mean, it sounds like powerful, transformative work. What's kind of the day of the life of the CEO at the Institute for Population Health?
In my role as the Chief Executive Officer, I'm designated to be responsible for all aspects of our organization, and that includes reporting to the Board of Directors. I report to the board chair. I'm responsible for making sure that we have approval for all of our activities as a nonprofit 501c3. I'm also responsible for the staff, making sure that the staff are trained and credentialed and privileged to work for the Institute for Population Health. Because we are grant funded through the HRSA program, there's many different requirements that we have to fulfill, and I fulfill all of those compliance measures for a federally qualified health center. And I'm also responsible for the financial stability of the organization. That means generating revenue outside of grant funds. That means expending revenues for the sustainability of the organization. And I just wanted to say that I've been in this role of CEO since 2016, and we've had a very positive financial audit, and we had some struggles at the beginning. We had a large deficit, but now we have a positive assets for our organization. And I just wanted to say, and I'll always say, I appreciate the board for supporting us when things weren't the absolute best for us. They didn't look very promising, but they gave me an opportunity to turn the organization around, and our 990s, IRS 990s, they look very promising.
Outstanding, outstanding. Early on, you talked a little bit about partnership, but talk to us a little bit about the role of community engagement. How does community engagement factor in your success?
So when we first started the Institute for Population Health, we were implementing some of the services for the City of Detroit Health Department as they were going through the bankruptcy process during 2012, 2013. And community partnerships was one of the roles that I had as the vice president of community engagement. So I learned the importance of community partners, because you could not do the work yourself, especially trying to reach people who were difficult to reach. Many organizations had visions and had clients, but they didn't have where we could link the patients with the resources. So I learned the importance and the benefit of partnerships. So let me also say that we have a program whereby we have a community coalition. And our community coalition meets every month, and it is a cross-section of state, county, and city government, patients with a lived experience, and churches, and community-based organizations, where we meet and we discuss what are the needs of the neighborhoods. And we conducted a community survey. And from the survey, we identified the physical needs, social needs of neighborhoods, and then we begin to say who's not at the table to begin to have solutions for the patients. For example, housing is a real problem in our community. Childcare, jobs, high school completion, transportation. And so when we bring these partners to the table, we learned what is already being done. The City of Detroit has many resources, but people out in the community may not know how to access. And so IPH is a neutral convener where we allow people to share resources, and we put the information out on our social media campaign, we put it on our website, so that our clients that we serve and people around in the region can have an opportunity to gain access to. All people can gain access to the city services that are available.
That's amazing. I really am really just excited to hear all of the wonderful things that you're doing as a part of your community engagement strategy, especially that community voice piece, because as you know, the community voice piece is a big part of the work that we do at the Regional Health Collaborative, really trying to amplify the voices of those that are being served so that they can kind of speak their truth to power and help us navigate what better looks like in terms of how they receive their benefits. What ways have you used strategy to include the community voice, and what ways have the community voice augmented, changed, supported ideas that you've had?
So one of the principles that we use is collective impact. We certainly started working with our consortium on how to achieve the 5 elements of collective impact. And I use that as a scientific basis for how we can move forward and how we can make change. So one of the things that we learn is that we need a common agenda. In order to get a common agenda, you have to take the time to get down to the root cause of the problem. And so that builds a relationship among the organizations. So that means that, we are not in competition, but we are in collaboration. So it takes time to talk about what you can bring to the table, what I can bring to the table, and sometimes that initial introductory process takes time. And you have to be able to take a step back and let that develop. Okay. You can't be so anxious to make change and have change without making first the relationship strong. We also learned too that you need to make certain that we have a shared vision. Again, that means dialogue, communication, and talking about what your vision is. And then we need shared measurements. Okay, how do we know when we've achieved our goal? How do we know what success looks like? And I think you said that earlier, Arthur. Um, so it took a year or longer, but we came up with shared goals. And that's how we determined that housing was a number one problem for our clients. That's how we determined that childcare, you want moms to go back to work, but if I just have a newborn, I need childcare. I need a place where I can trust. I need to be able to afford the childcare.
Right.
So we also learned that in order to have a good, strong partnership, you may have to have written agreements. You may have to have memorandums of understanding so that you can know what are the deliverables. Yeah. And you cut down on a lot of confusion and misconception when you're expecting a partner to deliver more than they can. They just don't have the capacity for that.
And Dr. Daniels, that has been a learning curve, for me in our work with the RHC. Is that it's not just when we talk about moving at the speed of partnership, that's exactly what that means, is recognizing that an organization may have an organizational desire or vision alignment, but whether they have the human capacity in terms of staffing or funding capacity to do some of the partnering work is really one of the challenges that we face as we do collaborative work, because we really have to move at the speed of partnership. I know with our Regional Health Collaborative, part of that was really learning everybody's kind of pain point. Everybody was all in for the collective vision and the collective effort, but not everybody could put the same amount of time or same amount of staff or same amount of, resources in. So we had to kind of figure out who can do what, and then how do we fold that what into the overall effort of the RHC. So for you, is because the RHC is also a collective impact model, is that collective impact model what attracted you to the RHC, or what kind of brought you into partner with the RHC?
It was the collective impact that I believe that we could make change that would be beyond the target population that the Institute for Population Health served. We're in certain zip codes. We target all people in those zip codes. But we know that there's some housing issues that is, citywide, that is region-wide, in other counties, not just in Wayne County and Macomb County and Oakland County. So that's what attracted me to this work, is that through SEMHA's vision, I would be able to be a part of a larger, broader social change. And I think that IPH has been a backbone organization, and we use our data and our partnership work to begin to look for additional funding. Because the premise is, if you want partnerships to exist, you have to support them in some kind of financial way.
Right.
And so we are, we had an opportunity to seek funding through the Kellogg Foundation, and we have had an opportunity to support our partners and their missions with what we were stewards. We're the backbone organization for these funds, and we were stewards to begin to give money to our partners, and the results have been phenomenal. The organizations have been able to educate more on health education. They were able to provide services through health fairs, through coalition building. They were able to link people to primary care services that had not been linked before. And through the coalition that Healthy Start has, through our backbone organization, we began to add a bus route that was eliminated. But because the clients who came to the meetings and voiced their concerns about having the lack of transportation, now the city of Detroit added a bus stop that had been eliminated in the past. So this is why it's important to have continuous communication and mutually reinforcement of activities. And the mutual reinforcement comes with giving seed money, if you can, sharing some of the wealth with the partners so that they can build capacity and continue with their vision.
The more you share really highlights really the power of leadership, the power of mission-based work, vision-aligned work, and effective communication. That's the only way to do partnering work. Is you have to have a clear understanding of what everybody's capacity is, what everybody's priorities are. How has partner with SEMHA or even the RAC helped the work that you're doing?
It has helped greatly, because it's an opportunity to, I met new partners that I have partnered with outside of the SEMHA arena.
And I love to hear that. That's why we're at the table. Partnered. I love to hear that.
And it was just like on last Saturday, I went to Third New Hope. And we were able to bring our mobile van to the community and provide services at that church, and to see the richness in the community and the church that is focusing on health and health screening. It was awesome. That's what the RHC has done for me. It has given me new partnerships. It has reinforced some of the activities that we were involved in. So now we're not like standing alone. Now I feel connected to other agencies. And I think you've done a wonderful job with selecting partners, just broad-based partners across different sectors. And you added the voice of people with lived experience and community health workers. And that is so profoundly rich, because that will take us to the social change that we need to have.
Well, before we wrap up, I want to give you an opportunity to elevate any projects or priorities that you have going on. Is there anything that you want to highlight?
Well, we do have our back to school rally, and it will be on the 22nd of August. And certainly we give immunizations, and we give out backpacks, and we have food baskets, and we have dental services and sports physicals. And certainly I thank you for this opportunity to share that. We're hoping that we have the community come out in large numbers. I know there's a lot of back to school events across the city of Detroit, and we just want to be a part of that service for people. We learn that sometimes when we give out immunizations, some people have not had immunizations for the whole year. And this is an opportunity to make sure that they're prepared for school. If they so desire immunizations, they have that opportunity. So I thank you for this partnership. I thank you for this opportunity to share information about the Institute for Population Health. And we're excited to be a part of the growth of the community and this partnership.
Well, That leads me right into my final question. What are your thoughts about the power of partnership and the power of collaboration? What does partnership and collaboration, what is their role in the change that we want to see in the community?
Collective impact. I don't see one organization making the change that's necessary at the systems level. That's the power of partnerships, and we need to be able to have a cross-section of state, county, city, public, private, churches, community-based organizations at the table. And we need to take the time to build that consensus so that we could have strength in numbers. Sometimes there's a lot of changes that go about with policies that you don't have any control over, but you can look for that silver lining and that strength. Okay, this is something that happened. This is a change. We don't have any control over it, but we can make certain that our staff has been trained, and so that we can train our clients. And that's what the power of partnership is, that you give out good information and everybody's at the table supporting one another from a strength-based perspective.
Thank you so much, Dr. Daniels. We're going to have to leave it there. I feel like we could talk for hours and hours, but I will be respectful of your time. Thank you so much for your time today and the information. I look forward to working with you and learning from you as we continue in this journey together with the SEMHA Regional Health Collaborative. Thank you for all the work that you're doing at the Institute for Population Health, and it's really an honor to be a partner with you in this change making we're trying to do in the Detroit area. Thank you so much.
Thank you.